Hey y'all, welcome back to my channel. For those who don't know me, I'm B. Today we're going to be getting into going into Med-Surg straight out of nursing school or going into your specialty. So I wanted to talk about this topic because I feel like for nursing students who are about to graduate, they always struggle with what specialty to go into and what would be the best decision for them. And I know throughout school, your professors, your advisors, and other students may tell you to do Med-Surg, or they may say go straight into your specialty, don't waste any time. And I just wanted to give y'all a chance to get my input because I also have these struggles as a nursing student graduating soon, and I just wanted to give y'all my intake on the topic. So before we get into this video, don't forget to like, comment, and subscribe to your girl's channel. And yeah, let's get right into this video. So I just want to start off saying that I am not biased. I think Med-Surg is an amazing specialty. Shout out to all my Med-Surg nurses, y'all do such a great job. But I also think that going into your specialty straight out of nursing school is an amazing idea, and I'm going to just tell you guys a little bit of why I feel that way and just give you some insight on why both decisions are good, but I am definitely leaning more towards doing a specialty that I want to go into rather than Med-Surg. But let me just tell you a little bit about Med-Surg first and why that would be a good idea. So a lot of your professors and a lot of your advisors that go through nursing school with you will definitely tell you to do Med-Surg over going into your specialty first. The reason why they'll say that first off is because it's a good stepping stone. So Med-Surg is a floor where you will learn everything, you will see everything primarily. Of course, you're not going to see, what do you call that? I'm blanking.
One eternity later.
Of course, you're not going to see somebody give labor there, or you're not going to see someone in critical condition as you would see in the ICU, but you learn a lot and you do see a lot of different diagnoses, which is really, really important as a nurse because it makes you well-rounded. Another great thing about Med-Surg as to why your professors and advisors may tell you that it's a good stepping stone is because you also learn a lot of medications. And I know during school currently, and yes, I am a COVID nursing student, I already don't get to learn about a lot of medications in my clinicals because we only have 2 to 4 a semester. So going into Med-Surg after you graduate, you'll get that chance to kind of learn everything that you may have missed during nursing school or even forgotten. So I will say Med-Surg is definitely a great stepping stone if you want to have a good start that's not too hard, doesn't have you too anxious or too nervous going straight into the field. So yeah, overall, to me, that's like the best things about Med-Surg. Learning all the medications, seeing different diagnoses, getting to experience different patients, you know, all that great stuff, and it makes you a well-rounded nurse overall. But let's talk about specialty. So first off, I'm going to just talk to you guys about what specialty I want to do. And for everyone who does know me, and for those of you who don't, I'll just say I want to go into ICU, that's intensive care. I love, love, love critical care patients, and I love the unit so much. And I'm going to tell you guys why. So people think that I'm crazy for wanting to go into intensive care, especially straight out of nursing school. But y'all, let me tell you, so when I was doing my Med-Surg rotation, I had explained to my clinical instructor that I really, really wanted to work with patients that were in the ICU. Thankfully, my Med-Surg rotation was on a neuro floor, so you're going to see a couple critically ill patients there if you get lucky. So my amazing instructor, I loved her so much. She is the best ever. Her name was Maxine. Amazing. Loved her. And she was our first Black clinical instructor, so... Period.
Period.
Shout out to Maxine, we love you. But yeah, she was so amazing, and she let me experience 2 very, very ill patients during my rotation with her. I had 4 rotations, and out of those 4, I got to have 2 very ill patients. So I was definitely scared and very, very, very intimidated walking into a room with a patient who couldn't talk, couldn't breathe on their own, couldn't tell you what was wrong with them, had a million different diagnoses, and needed a lot of care. These type of patients need full assessments because they're in bed all day. They can't describe their pain to you. They're incontinent, so they're using catheters and rectal tubes because they're just having complete issues like all over their body. It's so crazy, but it's so amazing because you learn so freaking much. Like, oh my gosh, I just love intensive care. So another thing that I love about intensive care is that you get 1 to 2 patients. Like, your focus is on 1 to 2 patients. It's very, very unlikely to even get 3. So I love that because having like 6 to 7 patients on a floor, like, it's a lot for me. I feel like it's a lot to keep up with. I'm pretty sure like when I get into the nursing field after school, I probably will get used to it. But I really just do like the idea of focusing on 1 to 2 patients and just giving them that full like intensive care. I don't know what it is, but I love it. I love having to like think too, and I love having to understand what's going on without the patient being able to tell me. I just feel like in ICU you gain so much knowledge, and it makes you such an amazing nurse, and it's a different realm of nursing. And y'all, if you could do ICU, trust me, you can do any type of nursing. Like, it doesn't get crazier than ICU. Maybe ER, maybe ER, because ER is like ICU but like 10 times faster, and that's not for me because I like to have time to like work with my patient and make sure my patient is in the best care that they need to be in, rather than being in the ER and I gotta rush the patient to patient. I'm doing all these type of focus assessments that are real quick, and the patient got these crazy diagnoses wrong with them, coming in with their head falling off. Like, you hear some crazy ass shit in the ER, okay? But it's also true that you do hear crazy shit in the ICU as well. But it's just different because, I don't know, you just get that time with the patient, and I love that. Like, I love working on 1 to 2 patients and just figuring out every single issue wrong with them and just making sure that they're getting the best care they can. And it's just, I don't know, it's so rewarding, it's so amazing, and it's just a good field. Like, you can't go wrong with ICU. But yeah, y'all, that's the specialty that I would like to go into. If you want me to talk more about ICU in a different video, I definitely will, but this is more so about specialties, so let's just talk about that. The reason why I feel like students should go into their specialty first rather than going into Med-Surg is because I feel like, in a way, Med-Surg can be a waste of time if you don't really want to stay there. So if you want to go into Med-Surg after school just because you don't know where you want to start, or you want to actually be a Med-Surg nurse, by all means, I say go for it. Like, that's the best place to be. But if you know what type of nurse you want to be, for instance, if you want to be a labor and delivery nurse, starting in Med-Surg isn't going to teach you how to be a good labor and delivery nurse. You're not going to know anything about taking care of women who are pregnant, who are in labor, any assessments that have to do with labor, really any medication that has to do with labor. So it's like, what's really the point? You know what I mean? And then people will like get their 1 year of Med-Surg experience, try to go into their specialty. So let's say you do your Med-Surg just because you want to be a well-rounded nurse and you want to start small. So you decide to do Med-Surg rather than going into your specialty. Let's say it's labor and delivery. Let's say it's psych. Okay. you're gonna leave Med-Surg, go into psych nursing, and be on a whole different unit with a whole different structure and a whole different type of field. You're going to be literally starting all over again and not knowing what you're doing. So it's like, who wants to even have to go through that unless you literally have to? So let's say, like for me, I want to be an ICU nurse, and I'm in ICU for 5 years, and then I want to switch to OR nurse, and I have to relearn everything. That's different because I'm making that choice myself. You know, like I'm done with ICU, I've had it, I'm happy, I learned enough, and I want to try something new, so now I have to relearn. That's a part of just switching nursing fields when you are either tired of the one you've already been on, or you just want to experience a different type of nursing. But if you've like wanted to be a psych nurse since you got out of school and you thought Med-Surg would be helpful, like that's not the case. Med-Surg is just helpful as a stepping stone. Just in general nursing, I would say it's not going to be helpful for you when you transfer to psych nursing, or you transfer to the ER, or you transfer to being a labor and delivery nurse. Like that's not the point of Med-Surg. So I don't want you to go into Med-Surg thinking that it's going to help you out in your specialty, because it's really not. Another thing, people also go into Med-Surg thinking like, I'll have this year of Med-Surg on my back, so when I go into my specialty, like I'll get the job, no problem, I'll get the job right away. That's also not true, and they don't tell you that. So I've talked to like a lot of grad nurses, and all the ones that I know that thought that going into Med-Surg first and having it on their back would get them into their specialty were completely wrong. They actually struggled to get into their specialty because they had no experience in their specialty. So Med-Surg isn't helpful in that sense either. So I'm telling you, if you want to get into your specialty unit and into your specialty field, go in that first. And the best ways to get a job in your specialty would be to make sure while you're in school in your last year that your internship is in that specialty, because that's where you're going to gain the most experience in that field. In addition to that, it's also good to get a PCA job in your field. Like for instance, I'm currently trying to get a PCA job in an ICU unit so that they can see that on my resume and be like, okay, like she's been in the ICU, she has an idea of how it looks in there, kind of what to expect and what the nurses do. And then if you also have the internship on your belt, they can see like, okay, like she actually followed a nurse around, did nursing duties as a student in the ICU. We're gonna actually take a look at her, and they'll probably more than likely give you an interview and hire you, opposed to if you did Med-Surg in your internship or went into Med-Surg, you know, after grad and then did it for a year. Like they're gonna pick the student who had PCA experience in the ICU and had internship experience on the floor in ICU over the nurse who has a year of experience in Med-Surg. Like I'm telling you, Med-Surg isn't to like help you progress in a specialty. I would say Med-Surg is just to help you in your nursing career as a whole. So look at it like that. Don't look at it as like, oh, this is gonna be like what's gonna help me get to where I wanna get to when I wanna transfer. It doesn't work like that. And last but not least, like, who doesn't want to go straight out of school into their dream career, you know? Like, I think about being an ICU nurse all the freaking time. Like, that's my goal, that's my dream, that's what I want to do. And if I could do that coming right out of school, I swear to you, like, that will be God's grace. Like, that will be like the most amazing thing, you know, for me. And I just feel so accomplished, and like that would be, you know, the best opportunity I feel, and I would absolutely take it. And when you're in nursing school and when y'all are nursing students, you know, like you talk about like what specialty you want to go to with your friends, you talk about what you plan on doing, what you can't wait for. Like it's your dream, like it's your dream career. So it's like, why miss out on that to do Med-Surg if you don't want to? That's what I'm saying. If you don't want to do that, why miss out on that? Like, go be that labor and delivery nurse, go be that ER nurse, go be that ICU nurse, like, whatever it is you want to do, like, go be that psych nurse, okay? Like, don't let no one stop you and tell you you should do Med-Surg if you want to do your specialty. That's all I'm going to say. And honestly, like, if you have a lot of anxiety, or if you're super nervous about like what's to come when you become a nurse, honestly, you're gonna be nervous on any floor. Like, coming out of school and being a nurse is not like something that's not gonna be nerve-wracking. Like, it's scary. So like, don't think like, oh, I'm gonna do Med-Surg, you know, instead of my specialty because I don't want to mess up, or like I'm too nervous, or like I'm too much of a beginner. You're gonna be a beginner on any floor, and like, trust me, Med-Surg or not, you're gonna mess up. Like, nobody's perfect, and when you're starting out, no one's perfect. And when you begin nursing as a job, you have a preceptor and you're on training for like months to a year. Like, they know you're not perfect, they know you need help. You're gonna have someone by your side constantly for a very long time. And listen, y'all, listen. We doing 12-hour shifts over here, okay? You are learning on the job 12 hours, 3 days a week. You're gonna learn, you're gonna know, you're gonna get used to it. When I first started nursing school and had my first assessment, I was super scared. I didn't want to touch the patient, I didn't want to hurt them. Now I do my assessments, I'm like, okay, boom, 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 done. Like, and like, y'all know that, like, you learn, you get better, you get more confident, you get braver. That's all that nursing is about. Like, do not be intimidated, because as a nursing student, you go through these things, like your first injections, your first shot, like whatever the case is. Like, it's scary. My first medication I gave through an NG tube, like, I almost had a heart attack. Like, I thought I was like hurting the patient. I was so scared, but like, after doing it 2-3 times, I'm just like, boom, boom, done. Okay, like, and I love it. Like, it's just, listen, like, y'all, even like my first injection, I know everyone's first shot is so scary. Now, giving shots are my favorite thing ever. Because of COVID, my school had us doing vaccines. I had to give over 100+ vaccines, and I was doing them things like this. Like, it was nothing, okay? So, just letting y'all know, you are that nurse. Don't let no one tell you any different. You can do your specialty, and I believe in y'all, okay? So if you really want to go into your specialty, you don't want to go into Med-Surg, all I can say is, my advice to you is do it.
What are you waiting for? Do it!
You deserve it, you worked for it, and you're here. So hopefully that gave y'all some insight on what you want to do. I hope I gave y'all some good advice. And again, not knocking Med-Surg nurses. We love y'all. Y'all are amazing. Y'all are knowledgeable. Y'all are great. But every specialty is amazing. And if you want to go into the one that's your dream specialty, do it. Don't even stress. You got this. I know you do. We all got this. So yeah, y'all, that was my take on it. I hope it was helpful. If you have any questions or concerns, please leave them in the comments. I would love to answer. And again, don't forget to subscribe to my channel. I love y'all so much, and I will see you in my next video. Bye.